Hello, everyone. Thank you for joining today's 2023 CMS Quality Payment Program MIPS Value Pathways Maintenance Feedback webinar. This webinar will review the recommendations received to date for updating the 12 previously finalized MVPs and give the public an opportunity to weigh in on those potential updates prior to rulemaking for QPP. This presentation will be followed by a Q&A session, and attendees will have the opportunity to ask questions. You can either submit written questions via the Q&A box, or you can raise your hand and ask a question via the webinar audio. To note, a recording of this webinar and accompanying slides will be shared online on the QPP webinar library within 2 weeks. Now, I will turn it over to Sophia Sukumar at CMS to begin.
Thank you so much, Olivia. Good afternoon, everyone. Thank you for joining us today for our first MVP feedback webinar. We previously finalized this policy in the calendar year 2022 rulemaking cycle, in which we would establish a process to publicly inform stakeholders and interested parties of the feedback we received on previously finalized MVPs. So if we move to the next slide. So for today, we are solely focusing on the webinar maintenance aspect of MVPs itself, and this involves the feedback we received, what we reviewed and deemed possibly feasible. These are recommendations we could potentially take into consideration for a 2024 rulemaking, but again, we are not committing ahead of the rulemaking cycle that definitively these updates are moving forward. This is key opportunity for you all to provide your feedback in terms of whether you agree with the feedback received and in terms of how it's highlighted in the slides, or if you disagree or want to point out a concern, we're happy to hear it. That will help us, make further considerations as to whether or not to make the given updates. I want to emphasize that just because we include suggested updates in the slide deck here does not mean they're definitively going to be carried through rulemaking. And in this instance, yes, there is potential for including that in through 2024 rulemaking as we deem feasible, but there's no commitment to that either. We can certainly take our capability to then determine whether it should be 2024 or future rulemaking in which the changes could be implemented. So I just want to flag those items today. We could not make any commitments that updates were definitively moving forward ahead of any notice and comment rulemaking, but this is just to give you an idea of this new process. We will establish that this webinar will happen annually, and that will then give stakeholders and interested parties an opportunity to provide feedback on a rolling basis throughout the year on previously established and finalized MVPs, and then give us an opportunity to share that feedback with you all ahead of rulemaking to really ensure that we have a broader cohort of interested parties providing input through the maintenance process. So with that, I will just say that today's webinar is focusing on the feedback we received. We aren't going to go through policy specific questions. So I'm very much aware that there's interest in the policy aspect and the operation side of MVPs. We're happy to receive those questions through our QPP Service Center. So please use that process to get those questions answered. We also have available on our QPP resource library on the QPP website an MVP policy related webinars. And so here are the two hyperlinks here. I believe the slide deck will be shared soon thereafter this presentation. We just have to go through our typical formatting processes. There are additional resources available through the QPP website related to MVP development and maintenance, and highly encourage you visit qpp.cms.gov to see what those resources are. Next slide, please. For today, we will be doing an overview of the maintenance process and feedback process and how we've collected that feedback and reviewed and the type of feedback received. We will provide you an outline of the previously finalized MVPs. It's not in every instance we receive feedback on every single MVP, so we just want to make our interested parties aware of the MVPs we have previously finalized and that they are up for comment throughout the year. There's not a specific time frame in which we'd only accept feedback on them. We would collect the feedback on a rolling basis, and then we would use this webinar to then talk through any feedback we believe are feasible changes we could make in future rulemaking. And with that, I will turn it over, if we move to the next slide, to Deb Kaldenberg from the PIMS team. We have a number of our contractor teams on that support the MVP development and implementation and maintenance parts of the program. And I do want to turn it over to them to walk us through the feedback received. Thank you.
Thank you, Sophia. And good afternoon to all of those who are in attendance today. As Sophia said, I'm Deb Kaldenberg from the PIMS team. The next several slides are a recap of the MVP maintenance feedback process that culminated in this webinar. Next slide, please. This particular graphic shows an overview of the MVP process from MVP candidate development through the MVP maintenance. This webinar's focus, as Sophia said, is specific to the maintenance feedback received to previously finalized MVPs, and that's feedback that we have received to date. Next slide, please. This slide shows an overview of the process for recommending changes to a previously finalized MVP and where resources that help guide you through the process can be found. CMS accepts maintenance feedback to previously finalized MVPs on a rolling basis. In your recommendation, you would need to include the title of the MVP along with a description of the recommended change or changes by performance category. For more details on what to include in your recommendations, please refer to the MVP maintenance process, the PDF, posted on the qpp.cms.gov website. Next slide, please. Feedback that was submitted prior to this webinar and deemed feasible by CMS will be reviewed in the upcoming slides. CMS won't be able to communicate with the general public about whether their recommendations were accepted outside of rulemaking and will ultimately decide whether updates to a previously finalized MVP will be incorporated. Any CMS-approved changes to a previously finalized MVP will be proposed through future notice and comment rulemaking. Next slide, please. Please note that modifications to existing MIPS measures and improvement activities in traditional MIPS will be reflected in any MVP that includes those measures and activities. Changes to QCDR measures may be submitted for consideration by the QCDRs that steward the measure during the annual self-nomination period. Changes to MIPS quality measures may be submitted for consideration during the proposed rulemaking comment cycle, or by contacting the measure steward directly. Changes to existing improvement activities and cost measures may be submitted for consideration through the annual call for measures and activities. Any changes to existing MIPS measures and improvement activities will be proposed through future notice and comment rulemaking. Next slide, please. Previously finalized MVPs are provided for reference on the next two slides. Next slide, please. There were a total of 12 previously finalized MVPs available for the general public to provide CMS with any recommended maintenance feedback. And this slide shows 6 of those 12. Next slide, please. And here are the other 6 previously finalized MVPs. We will be reviewing feedback received to 8 of the 12 previously finalized MVPs. Next slide, please. And now we will begin reviewing the MVP maintenance recommendations submitted for CMS consideration. Next slide, please. These next 3 slides will include recommendations that were specific to the adopting best practices and promoting patient safety within emergency medicine MVP. A recommendation was received to add quality measure 65, appropriate treatment for upper respiratory infection. CMS has determined the recommendation is appropriate as the measure includes the emergency department setting within the denominator eligible coding, and the quality action is attributable to this clinician type. Ensuring the MVP represents meaningful measures to the intended clinician scope of care is important. Next slide, please. There was also a recommendation to add the promoting clinician well-being improvement activity to this MVP. Next slide, please. As well as the create and implement an anti-racism plan activity. CMS determined that both of these activities were appropriate as they are relevant to clinicians practicing in an emergency medicine setting. Next slide, please. The next four slides include recommendations specific to the Advancing Cancer Care MVP. A quality measure recommendation was made to add a pro-PM patient experience measure. Ensuring the patient's voice is being captured within each MVP is extremely important to CMS. Assessing that care goals and treatment are in alignment with the patient's wishes is vitally important, especially for those patients with chronic conditions such as cancer. Next slide, please. There were a total of 6 improvement activities that were recommended to be added to the Advancing Cancer Care MVP. CMS has determined the recommendations were appropriate as they are relevant to the treatment of cancer. The recommended activities included promoting clinician well-being, practice improvements to align with Open Notes principles, use of telehealth services that expand practice access. Next slide, please. Implementation of a personal protective equipment plan. Next slide, please. And participation in Joint Commission Evaluation Initiative. And finally, completion of an accredited safety of quality improvement program. Next slide, please. These next 2 slides include recommendations received regarding the Advancing Care for Heart Disease MVP. The improvement activity recommended for addition was the regularly assessed patient experience of care and follow-up on findings activity. CMS has determined the recommendation to add this activity is appropriate as this MVP doesn't currently include a patient experience survey quality measure. This is in alignment with our goal to include the patient voice whenever possible in the MVPs. And now I'll hand the presentation over to Ellie Newsom to cover the cost measure recommendation for the Advancing Care for Heart Disease MVP. Next slide, please.
Thanks, Deb. So for this MVP, we received feedback regarding the use of the total per capita cost, or TPCC measure, and the Medicare spending per beneficiary, or MSPB clinician cost measure. The suggestion was to replace the TPCC measure with the MSPB clinician measure. After reviewing, we determined it would be appropriate to consider the MSPB clinician measure as it does capture costs related to inpatient cardiac care. We also still believe that it would be appropriate to continue to include the TPCC measure as it assesses ongoing costs of care within a clinician-patient relationship, and cardiologists are included in the TPCC measure. Additionally, the TPCC measure's intent aligns with the inclusion of preventative care, screening, and primary care related quality measures, and is useful in assessing value within this MVP. So as a result of this, we'll consider adding the MSPB clinician measure and continuing to include the TPCC measure. And with that, I'll pass things back over to Deb.
Thank you, Ellie. The next 3 slides include quality measure and improvement activity recommendations received for the Advancing Rheumatology Patient Care MVP. The quality measure recommendation was to replace quality measure 111, pneumococcal vaccination status for older adults, with quality measure 493, adult immunization status. CMS reviewed and determined that this recommendation is appropriate as it ensures consistency with CMS's goal of promoting alignment across measure sets, in addition to evidence to support the utility of the zoster and TD-Tdap vaccines for individuals with rheumatic diseases. The comprehensive evaluation of compliance with recommended adult immunizations is clinically relevant to this clinician type. Next slide, please. The first activity recommended was to include the regularly assessed patient experience of care and follow-up on findings activity to this MVP. This recommendation is considered appropriate as the MVP doesn't currently include a patient experience survey quality measure. In addition, this would be in alignment with our goal to include the patient voice whenever possible in MVPs. Next slide, please. The next two activity recommendations were determined to be appropriate as much of the rheumatology patient population requires assistance given the associated costs with the medications used to manage their disease. As a result, CMS will consider including both the financial navigation program and the drug cost transparency activities in this MVP. Next slide, please. There was one recommendation received specific to the coordinating stroke care to promote prevention and cultivate positive outcomes MVP. The recommendation was to add the regularly assessed patient experience of care and follow-up on findings activity. As in similar scenarios, CMS has determined that the recommendation to add this activity is appropriate as the MVP doesn't currently include a patient experience survey measure. Next slide, please. And the next three slides are going to cover recommendations that were received for consideration to the optimal care for kidney health MVP. The recommendation was made to add quality measure 488, kidney health evaluation. CMS determined the recommendation is appropriate as the quality action is applicable to and can be performed by a nephrologist to monitor patients with chronic kidney disease and diabetes, and as a result, we'll consider including measure 488 in the MVP. There was also a suggestion received to replace quality measure 110, preventive care and screening, influenza immunization, and quality measure 111, pneumococcal vaccination status for older adults, with quality measure 493, adult immunization status. CMS determined this recommendation was appropriate as it ensures consistency with CMS's goal of promoting alignment across measure sets, in addition to evidence to support the utility of the zoster and TD/Tdap vaccines for individuals with kidney disease. The comprehensive evaluation of compliance with recommended adult immunizations is clinically relevant to this clinician type. Next slide, please. It was also recommended to replace the implementation of methodologies for improvements in longitudinal care management for high-risk patients, improvement activity, with the chronic care and preventive care management for impaneled patients activity. Next slide, please. This recommendation is considered appropriate as the chronic care and preventive care management for impaneled patients activity better targets the MVP population while still advancing care coordination. Therefore, CMS will consider this replacement in the MVP. Next slide, please. The recommendation was made to consider adding the regularly assessed patient experience of care and follow-up on findings improvement activity to the optimal care for patients with episodic neurological conditions MVP. CMS has determined the recommendation to add this activity is appropriate as this MVP doesn't currently include a patient experience survey quality measure. This is in alignment with our goal to include the patient voice whenever possible in MVPs. Next slide, please. The next two slides include recommendations received to the patient safety and support of positive experiences with anesthesia MVP. The suggestion was made to add the intraoperative hypotension among non-emergent, non-cardiac surgical cases QCDR measure to this MVP. If the QCDR measure meets all requirements, CMS agrees that adding the measure would be appropriate. Managing mean arterial pressure during non-cardiac surgery is an imperative to ensuring positive outcomes and is attributable to the anesthesiologist. Ensuring the MVP represents meaningful measures to the intended clinician scope of care is important. Next slide, please. It was also suggested to add the implementation of formal quality improvement methods, practice changes, or other practice improvement processes improvement activity to this MVP. This is a broadly applicable improvement activity, and therefore it would fit within the clinical topic covered by the MVP. Next slide, please. The recommendation was made to consider adding the regularly assessed patient experience care and follow-up on findings improvement activity to the supportive care for neurodegenerative conditions MVP. As in previous cases, CMS has determined the recommendation to add this activity is appropriate as the MVP doesn't currently include a patient experience survey quality measure. And as previously stated, this is in alignment with the goal to include the patient voice whenever possible in MVPs. This does bring us to the end of the recommendations received that were deemed feasible by CMS. In each case, CMS will consider whether or not to move forward with the recommendations. As previously noted and shared by Sophia, any CMS-approved change to a previously finalized MVP will be proposed through future notice and comment rulemaking. Next slide, please. These next few slides will outline the available MVP resources. Next slide, please. For more information on MVPs, please visit the following web pages or download new and helpful quality payment program resources. Next slide, please. In addition, we encourage you to review MVP resources and past webinars for more information. Thank you for your time today. Now I'll hand the presentation over to the Ketchum team to begin the Q&A session.
Thanks, Deb. So yes, we are now going to start the Q&A portion of today's webinar. And as a reminder, you can ask questions using the Q&A box, or you can raise your hand to ask a question live, and we'll go ahead and unmute your line. And just a reminder, I know Sophia did mention it at the start of the call, but we are only covering questions that on topics related to this webinar, so specifically MVP maintenance. Other questions can be submitted to the QPP Service Center. And it looks like we have received a couple of questions, so we will start off with some that we've received. The first question reads, will MIPS CQM measures that are currently only available to and in specialty registries be made available to other QCDRs? My concern is that the specialty MVPs that are heavy and specialty specific MIPS CQMs will give the specialty registries a monopoly on reporting and make it difficult for smaller groups or providers who cannot afford to participate in these registries to be successful.
Hey, Olivia, this is Sophia. I could take that question. I think I'm just going to clarify MIPS CQM measures, which in other programs may be known as registry measures, are widely available and are not necessarily limited to being reported only through a QCDR or qualified registry. You don't need to use a third-party intermediary to report MIPS CQMs. That is different from QCDR measures, which are limited in that they're only available through qualified clinical data registries. So just want to provide that clarification because when we develop MVPs, we are being very mindful to ensure that we have a balanced set of MIPS quality measures, which can be reported without a third-party intermediary, and QCDR measures as they are applicable and available and fully tested. So surely, if you are trying to report an MVP and it includes QCDR measures and you as a clinician want to report those QCDR measures, then you would have to work with the qualified clinical data registry because that's the only way that you could report a QCDR measure that's consistent with what happens in traditional MIPS. But if you want to report that MVP and you want to report on the other measures available, the MIPS quality measures, then there's no need to work with the third-party intermediary necessarily. It really is contingent on the clinician's flexibility to work with the third-party intermediary. Not sure, surely they have more measure choices when they work with the QCDR because you have that additional library of measures available to you. But there is no mandatory nature to that, and the CQM measures are proposed and finalized through notice and comment rulemaking. So they are different from QCDR measures, which are approved through self-nomination, and for purposes of MVPs, they are included in notice and comment rulemaking, but there's a separate approval process for that, and we have limitations as to how QCDR measures can be reported.
Great, thank you, Sophia. And we did receive another question that reads, could you please add more outcome or high priority quality measures to the Promoting Wellness MVP? Right now, the choices are very limited.
We can definitely take a look at that. So thank you for flagging. Since we do have capabilities through the maintenance process to make updates, we will be mindful to look at the Promoting Wellness MVP to see what else can be added from a high priority perspective if no additional outcome measures are available or vice versa. So we'll take a look at that. We'll track that as a team. Thank you for flagging.
Thank you, Sophia. And we did just get a message asking for clarification of when these potential changes would go into effect, and just someone asking if it would be the 2024 final rule.
We can't commit to when. We will just say that, through this cycle, the intention with this webinar is to then identify from the CMS perspective feedback that we feel is implementable. So it possibly is in the next rulemaking cycle or a future one. I can't say definitively when or if it's definitively going to be proposed. That will all happen through notice and comment rulemaking. So stay tuned.
Great, and it looks like we do have one person who has their hand raised. So Rosalind Lowry, we have unmuted your line, and you may have to unmute on your end as well. And Rosalind, you can go ahead and ask your question if you're ready. Okay, you may be having some tech difficulties. Jennifer Holcomb, we will unmute your line and you can ask your question as well.
Can you hear me now?
Yes, we can hear you.
Okay, this is Rosalind Lowry. Sorry. Can I ask just a follow-up on that first question? I thought it was pretty intriguing. So my group is a urology group, and we received the proposed urology, one of the proposed urology MVPs, and a lot of the measures were specialty registry specific. And in the event we were unable to participate in that specialty registry, we wouldn't be able to participate in our urology MVP because there wouldn't be enough measures left over. So I was really glad when I saw that question pop up.
Hi, Rosalind, it's Sophia. We'll take a look. I think what you're talking about is not an MVP that has been proposed yet. It's a candidate that's in progress being worked on with some external entities. We intentionally we would ensure as a part of our MVP development process that the MVP could be reported outside of a QCDR or qualified registry too. The CQM measures, again, while they are specialty specific, they can be reported without a third-party intermediary. We'll just go back and double check that. We haven't received the candidate as of yet as a formal submission. So when that time comes, the team is very mindful to look for those nuances as collection type limitations within each of the measures and how it could be reported. We definitely are very mindful that not everyone can afford to use a third-party intermediary, and we don't make that assumption at all. So we will definitely, thank you for that feedback. We'll take a look when it comes in and be mindful to work with our collaborators on that to ensure there's balance.
Thank you so much.
Great, and just a reminder for folks, you can raise your hand if you'd like to ask a question. via the audio or submit a question via the Q&A box, and we will give it a couple more minutes for folks to submit questions.
I think we received a few questions, Olivia, and I'm sorry, I haven't flagged them. There's a question related to whether or not if we add more measures to an MVP, would we consider increasing the number of measures on which a clinician is required to report? At this point, we have not made that determination. The point of adding more measures or trying to strike the right balance of having available measures in an MVP is to offer choice. We previously finalized that within the MVP reporting, the clinician would have, our clinician or MVP participant would have to report 4 measures, one of which should be a high priority or outcome measure. We have not talked about increasing. While we would want to add more measures if there's more, clinically diverse measures to include in a given clinical area, we would just want to be mindful of the volume. So we don't want to overwhelm clinicians in a given specialty with having this long laundry list of measures in an MVP, because we've heard a lot about in traditional MIPS how that can be overwhelming when you have too much choice. So we're trying to strike that right balance, and certainly through the maintenance process, we'll be cognizant of trying to do, that, be mindful of adding and removing measures accordingly. So just want to flag that. We did receive another question asking or indicating that the lower extremity joint repair MVP includes mostly quality measures without benchmarks. We'd like to see additional quality measures added that have benchmarks, such as tobacco and documentation of current medication. So thank you for that feedback. We are aware that there are instances where measures that are included may not have benchmarks. We are hopeful that through MVP reporting and the limited subset of measures that are available in an MVP, that over time that will lead to more data being garnered or gathered on those individual measures. And then that way we will then be able to achieve benchmarking status for some of these measures. We will consider the inclusion of additional measures, but we are, and I think the ones indicated are some of which are cross-cutting measures. We're just trying to strike that right balance because, the intention of having specialty reporting on MVPs is to have more specialty specific data available. So again, we are mindful that some of these cross-cutting measures are still clinically relevant, but, making sure that the large majority of measures are specialty specific is also important as well. There is a question related to, sorry, I lost my place. There was a question related to population health measures, and if we had any thoughts on adding additional population health measures. The ones that are included seem to be limited. We are open to suggestions. I think it just being mindful of the current population health measures we have are administrative claims based. So we are trying to balance the reporting burden associated with those measures that require data submission versus these that don't. We are aware that these measures have their limitations in that they require certain group sizes and otherwise they're not calculated. So certainly if you have suggestions, we are open to hearing, more about that, and you can certainly submit, feedback through the solicitation process for us to consider. Are the MVPs active now? Yes, actually for calendar year 2023, it's our first year of MVP reporting. So they are available for reporting beginning with this year. And a list of those MVPs are available. There's 12 in total. They are available on our QPP website. If you go to the QPP website and then search for MVP specifically, you'll see there's a whole list, and there should be downloadable documents that include the details of every single MVP. You're asking specifically about a measure. As long as that measure is included in MVP, then yes, it would be available. And that measure, if it already has a quality ID, I assume is already previously finalized and is available generally for reporting. The next question that's coming in the thing, and I'm just going down the list, and others feel free to jump in if you want to answer them. I'm just trying to be cognizant of the questions we receive related to ECQMs. And there's a note that some MVPs do not have enough ECQMs for a given MVP participant to only report on ECQM measures, and that this isn't aligned with the priorities to digitalize measure collection. So we are aware of this limitation. The measure inventory in MIPS has a limited number of ECQMs, and that is something we are tracking to internally. We are hoping over time that changes, and that will probably tie to this vision work related to digital measure reporting and FHIR implementation. And those are long-term strategies. So internally, we are tracking that over time, that this is something we would need to resolve. I just can't give you a time frame as to when that will occur. There's a question related to asking what quality measures are in the stroke rehab MVP, the stroke care MVP. I don't have it offhand, but I think, team, if you don't mind sharing the link to that document, it should be already posted in our resource library, and I think that could be leveraged to review what measures are available in that MVP. How can a large group practice not associate with a group or ACO transition to an MVP? You don't have to be a part of a large practice or an ACO to transition to MVP reporting. It's also available to individual small practices. Their resources are available. I would highly suggest you take a look to see what measures and activities are included in the MVP. Take a look at the reporting requirements. I believe we have an MVP implementation guide that would tell you what the reporting requirements are generally, and you could kind of work from there to then determine if your practice is ready for MVP implementation, identifying which measures within the MVP you would report from the quality standpoint, and improvement activities as well. There is a cost measure there that will be associated with that MVP and associated PI requirements and population health measures. So I would just take a look at the requirements, and that would be a decision you would make as a practice as to whether you are ready for calendar year 2023 reporting, or if we choose to wait till the following year.
Somebody have that?
And sorry, if someone else is speaking, you're not on mute. There is feedback related to CQM measures being topped out in MVPs. We are aware that there are many CQM measures or MIPS quality measures generally that may be topped out. We are looking into potential future solutions related to that. We can't answer now whether or not we would score those measures differently, but it is something we are looking into internally. With the pop health measures, is a thought on taking higher of the two? I will have to check with the team. I don't know if there are folks on from the scoring team that can answer. I thought we had a scoring hierarchy in place for the pop health measures, but I'll defer to them to confirm. Will we have webinars to educate on MVPs and to know if they are a better decision from traditional MIPS for 2023? Well, we just had a webinar in November and December, I think, related to MVP implementation. I guess what would be helpful from our perspective is what additional information would be helpful in informing your decision making as to whether you should transition from traditional MIPS to MVPs. Generally, there should be some level of familiarity with the measures and activities, because these are pulling from measures and activities from the existing inventories. What's changed is with the reporting requirements, and I think we've previously had webinars related to that, to kind of outline what the reporting requirements are, as well as externally published resources related to MVP implementation. So if looking at those resources, I would highly suggest you take a look at the QPP website and the MVP section specifically. If you have feedback on additional resources beyond what is already published, that would be helpful. Please let us know. You can submit feedback through the QPP Service Center to let us know that. We are trying to be mindful to create meaningful resources and just don't want to inundate the library and our interested parties with multiple resources that will rarely get used. So anything unique to what we've already published, any feedback on that would be great. Okay. A lot of these other questions, I know I've been trying to go down the list, but a lot of these other questions are not necessarily related to the maintenance process. So, and I don't know that I can give you feedback on all of these now. So I will suggest that if you have additional questions, you submit those that are outside of MVP maintenance itself. You submit those to our service center. And from this point, if there are any additional maintenance related questions, we're happy to take those.
And just a quick reminder too, if you do want to ask a question live, please go ahead and raise your hand. That icon should be at the bottom of your screen and we'll unmute your line.
I'm not, Olivia, seeing any additional questions at this time related to maintenance specifically.
Yes. Quick reminder, we'll give it another minute. If you do have a question related to maintenance, please go ahead and raise your hand or submit the question via the Q&A box. We don't have any at the moment, so we'll give it one more minute. Okay, Sophia, we haven't received any new questions. It doesn't look like anyone's hand is raised to ask a question, so we will turn it back over to you if that works.
Sure, thank you. Thank you all for attending today. This was our first webinar. Hopefully it went well. We're certainly open to receiving more feedback on the existing MVPs. If you haven't had a chance to submit, there's not anything that precludes you from submitting now or in the future. So please feel free to do so using our established processes for stakeholder feedback related to MVP maintenance. Separately, just flagging that we just finished our first 30-day comment period related to new candidate MVPs that we could potentially propose in future rulemaking. That concluded on February 8th. So thank you all to those that have participated and submitted feedback. We appreciate the feedback received. We will be reviewing that internally and are planning to publish that feedback in the near future for interested parties to be aware of and read through. But just wanted to thank you all for attending today, and we will likely post the webinar recording and the slides in the next few weeks. So if you need that, that will be available on our QPP website. Thank you again.